Welcome, everybody. I'm Dr. Jody Jacobson Fry. I'm the co-chair of the Workplace Suicide Prevention and Postvention Committee with Dr. Sally Spencer Thomas. And welcome to our webinar today on caregiving for caregivers. I'm very excited to introduce our speaker today. Johanna Louie is a licensed clinical social worker who's passionate about caring for caregivers. In her 10 plus years working in suicide prevention, she's had many different roles, including suicide crisis line manager and psychotherapist, as well as director of clinical training programs and faculty. In 2018, she co-founded Suicide is Different, and to this day, the organization provides support services for both professional and family caregivers who are caring for someone who's thinking about suicide. Johanna holds a master's degree in social work from Columbia University and a human behavior degree from the University of Southern California. Very excited to have her join us for this important topic. So this webinar is brought to you from the National Guidelines for Workplace Suicide Prevention, and they are supported by a collaboration through the American Foundation for Suicide Prevention and the United Suicide Survivors International. Our guidelines are founded on 8 guiding principles, and we try to make sure that this work is threaded throughout all that we do on prevention and response in suicide prevention. We also identify 9 key practices that help us to make suicide prevention a health and safety priority in the workplace. Today's presentation on caring for caregivers is actually going to touch on all 3 different levels that you see here, including upstream, midstream, and downstream practices for suicide prevention. So without further ado, I'm going to turn it over to our guest speaker, and thank you again for being here, Johanna, to share your expertise with us.
Thanks so much, Jody. So today we are going to be talking about caregivers. Specifically, we are going to be referring to the caregivers that support a loved one who is thinking about suicide or going through a mental health struggle. We will understand why this population is unique, how to identify them in the workplace, and also provide you with some strategies that you can implement in your organization. So let's talk a little bit about the unmet needs of this population. Why are we talking about them specifically and not caregivers at large? In a study done by AARP in 2020 about caregivers, one statistic really stood out to me was when it was talking about workplace discrimination. 5% of caregivers reported on average that they felt discrimination in the workplace because of their role as a caregiver. And that number went up to 12%, so more than double for suicide and mental health caregivers. So what we're seeing is that a lot of folks do feel like they are kind of given different treatment, and more so than general caregivers because of the nature of the caregiving that they do. We hear the phrase suffering in silence a lot when people talk about someone who is going through a challenging time emotionally, maybe has a mental health diagnosis. That same reason, because of the stigma of how it can be difficult to talk about this, carries over to their caregivers as well. A lot of times caregivers can feel like they can't bring up what they're going through. They feel like others might not understand. In addition, what's very unique to suicide and mental health caregivers is that they are oftentimes not really included in the caregiving process in terms of getting information from providers. Because of HIPAA and other reasons, providers are less inclined to include them. And that can lead to them feeling like there's less direction about how they can help, and also leads to some ambiguity in their roles for these types of caregivers. Because someone who is going through a challenge with their mental health, maybe they have a diagnosis, maybe they're experiencing some thoughts of suicide, that can go on for a long period of time. Maybe there are times of crisis, there are times when those feelings are more dormant. The period of caregiving is prolonged. Even when maybe the issue at hand is resolved, these feelings of thinking about suicide and going through mental health challenges can come up again. So caregivers are being in that role of support for a longer period of time, which leads to increased caregiver strain. You might think about like, okay, so this is a very unique population. We need to support them because of these factors that go into their experience. But how often does this occur, right? So let's talk a little bit about the prevalence of this experience. NAMI did a survey in 2015 that estimated around 8.4 million Americans were in the role of mental health and suicide caregiving. This actually we've seen an increase in the more recent surveys. That it wasn't the same survey that was done, but a jump was seen in the AARP survey from 21% to 27% of all caregivers stating that they were supporting someone with an emotional or mental health concern. While we do not have specifics on suicide caregivers, the Harris poll also had a study in the 2020 period that they surveyed adults and 55% of them reported knowing someone who thought about suicide. With that said, we can draw from that there are probably more adults that are in this position than we believe, even though there might not feel like there's a specific statistic that's telling us how many people in the workforce is caring for someone who's thinking about suicide. So being able to identify these caregivers in the workplace is the first step, right? And there are a couple of things that are sort of like telltale signs to help us, and maybe are invitations for us to reach out to someone and check in with them and see if they're in this role. This can occur in changes in the conversations that they have about loved one. Perhaps someone who's talked a lot about this one person, maybe they brag about their child a lot, all their accomplishments, and suddenly they stop bringing up their child and they don't talk about their child in conversation anymore. That could be a sign that we want to check in with them and ask about, hey, what's going on with so-and-so in your life? Have things changed? Discussing issues about a loved one very vaguely, talking about like, oh, like there's a lot that I have to deal with regarding my husband, or there is something that I need to do around supporting this person, but not giving a lot of details can be another sign, just because in the workplace, sometimes it can feel more comfortable to say like, I am taking care of this person and they're going through cancer, right? That feels different than like having to explain mental health issues or having to explain their thoughts of suicide. Also, someone who is distracted and always on edge, maybe like jumps a little when they hear their phone ring. Small things like that may also be a sign. Of course, there are other reasons why someone might be distracted at work. There are other reasons why someone might be kind of on edge when their phone rings, but that's another sign that we kind of see in the workplace that may tell us that someone is a caregiver and they're supporting someone through suicide or mental health issues. So let's look at some of the action steps that we can take within the workplace. And these are correlated with some of those 9 practices. And the first one is to increase the understanding of suicide and mental health caregiving within the workplace. We want to help folks understand and normalize that mental health caregiving can take a toll on folks, can impact someone's workplace performance and their participation in the workplace. So help folks kind of recognize like, hey, like it's actually very comparable to other sorts of caregiving in terms of the impacts that it can have on a person. And then also look out for signs and the need to provide support more actively. So this really starts with leadership, right? Leadership acknowledging this type of caregiving and providing training, maybe helping managers recognize the signs in people that they are supervising and even peers in some ways, so that there's education around the group so they know to kind of look out for each other or check in with each other when they see that this might be something that someone in their team is going through. The next would be to support caregivers when they need to step away. So again, there are some elements that leadership can really play in terms of cultivating this caring culture, recognizing that they might need to be a little bit flexible with understanding the situation. When someone is a caregiver for mental health needs or for a loved one who's thinking about suicide, there may not be the documentation and proper paperwork that someone who is going into surgery might be able to kind of bring to showcase, like, hey, this is why I need to take time off, right? So working independently, individually with the person to understand what are the needs that you have now, what are the accommodations that you need, right? Working with employees to customize that. And a way of doing this can also be mobilizing peers, allowing there to be training amongst peers and within the organization so that folks are more aware of this, and that there can be like formal and informal initiatives towards creating a workplace that supports this type of caregiving. And then lastly, having the appropriate resources on hand. Later in the end of this presentation, we do have a list of resources that are curated for y'all around this topic. But the idea is to know when you hear someone is caregiving for suicide, caregiving for mental health, know where you can point them, right? Offer different programming that's specific to supporting caregivers, whether it be, Suicide is Different, which Jody mentioned that I founded, but also, the National Alliance for Mental Illness. They have groups that are specific for family members and loved ones who are struggling with mental health issues, right? So again, we can make sure that we're providing those resources so that there's easy access when this topic comes up. Earlier, we mentioned that I also am in positions where have been working with workplaces to support professional caregivers. So whether it's, crisis line counselors or therapists or doctors, people who are in a caregiving role in their professional life, there are some special things to think about in terms of those workplaces. So evaluating what are the work responsibilities of these people who are caregiving in their job, and then making sure that we're kind of weighing how do these tasks contribute to burnout, and different ways to prevent burnout by adding in more variety of tasks, maybe some administrative time, so that folks can have time to kind of relax a little bit, do some work that maybe doesn't require the same emotional toll as caregiving requires. Also, equipping the staff with self-care tools, right? Not just, a lot of times we hear folks being told to take time for self-care, but not told how to do that. So offering tools that can help them monitor their wellness and take care of themselves. And then also offering paid time off for mental health needs, mental health days, that has found to be really effective, and allowing staff to use their work hours also to do things that can help them create more of a balance, has shown to be really effective. The core idea here is to think about the needs of your staff, if they're professional caregivers, as you would consider for those who you are serving, right? So again, if you're preaching care and support and love and empathy for the people that you're providing services to, making sure that that is provided for your staff as well. Another quick note about professional caregivers is that a lot of times, because of their profession, they are looped into situations in their personal lives to be that go-to caregiver as well. So recognizing that if you are in a professional caregiving workplace, that a lot of folks that you work with may also be a caregiver in their personal life, and considering how that can kind of double the toll that it's playing on them, and recognizing that providing additional support may be needed. With that said, I'm here to wrap up with some resources. Specifically, I know Suicide is Different. We provide support specifically to caregivers for someone who's thinking about suicide. We, of course, have the 988 Lifeline that takes calls from third parties, family and loved ones, that can be really supportive, as well as these other resources available. Want to make sure that you all are aware of them, and I will hand it back over to Jody.
Thank you so much, Johanna. That was a wonderful presentation to really help us understand the unique role of caregivers who are caring for people who have suicidal thoughts, and the role of the workplace at so many different levels, and the different actions, policies, and programs that can be taken. So we really appreciate you spending time with us today. And we thank everybody who's watching this webinar who want to learn more about this topic and other topics related to workplace suicide prevention. So as we close, I would like to make a call to action and ask everybody who is watching today to take time and go to www.workplacesuicideprevention.com. Here you'll find resources like the ones that we talked about today and an opportunity to take the pledge to make suicide prevention a health and safety priority for your workplace or professional organization. Thank you again for joining us.